Thank you, Doug. And thank you for everyone for being here and joining us this evening. This is Don't Kill Grandma, Young People in COVID-19. And the whole purpose of this event is to reach 18 to 34-year-olds, as well as those who consider themselves young at heart, with valuable information about how you can still live your best life while being safe and reducing the potential for spreading this virus to others. My name is Robert Singleton, and I'm the Executive Director of the Santa Cruz County Business Council, which represents the 85 or so largest companies here in Santa Cruz. Our job is to promote community and economic vitality through advocacy, and we've been working hard with other community organizations and the county to reach as many people as possible with this potentially life-saving information. I'd also like to recognize our partner organizations who have helped us tremendously in getting the word out about tonight. We are joined this evening by Doug Erickson and Matthew Swinnerton of Santa Cruz Works, which helps promote our local tech industry and ecosystem, which, as you can imagine, employs a lot of young folks. We also have Brandon Napoli of the Small Business Development Center at Cabrillo College, which helps entrepreneurs navigate the difficulties of starting a new business with resources, training, and mentorship. And then we have the Community Foundation of Santa Cruz County, represented by Susan True and Jenny Kurzweil, which is the local organization that supports all of our wonderful nonprofits here in Santa Cruz County and helps attract philanthropic resources. So thank you once again to all of our partners who helped make this event happen. Now, before I turn it over to Dr. Newel and Professor Kilpatrick, I want to cover a few housekeeping items and talk a little bit about our mask giveaway. So just for the record, you can hear and see us, but we cannot hear and see you. We'll be turning on the Q&A portion of this event after our speakers are done. We'll also be opening up chat then. It is also at that time when we'll be posting a Google link for those of you interested in being eligible to win a free Merge 4 mask, and more information about that coming up. We'll be moderating the Q&A to make sure that we are weeding out any questions that we don't deem to be constructive to the overall conversation. And so myself and Doug Erickson will be doing that. So now we do have 100 of these Merge 4 masks to give away. And as of the start of this event, we had 300 RCPs. So you can actually have pretty good odds of winning a mask tonight if you hang around. And on that note, I would like to turn it over to Cindy Busenhart from Merge 4, who can talk more about the masks that we'll be giving away tonight. Cindy, you can go ahead and turn your...
Robert. Yeah. Super appreciate it, and we're so honored to be here. I think you're in super good hands with this group. Well, Merge 4 wanted to build masks with the say it, don't spray it in mind. The masks actually block spray, which reduce risks, and I'll let the experts talk to you more about that. But if we all wear masks and we practice social distancing, especially indoors, it's just going to help everybody. So Merge 4 thoughts were to create a mask that was comfortable so people actually wear them. And then to put cool art on it from a lot of local artists from Santa Cruz County to kind of let your personality shine or your inner sparkle shine. We wanted to make it super fun. So hopefully you're more inclined to wear your mask. And you know, I don't want to be discriminatory, but we don't want to kill grandma or grandpa. But here's some of the designs that we have. So you can see this is one of my personal favorites. Even if you're in bad mood, you're still shining. We've got some great, here we go, some skate designs and some really cool skull designs. So, and again, a lot of local artists. So I'll let the pros take it from here, but I just want to say thanks for having us and thank you all for coming. You guys are all awesome for taking the time, and I know all of us here appreciate it. So thanks, Robert.
Great, thanks, Cindy. Appreciate you so much for these incredible giveaways. I'm super excited about being both safe and stylish. And so with that, I think it's time we began our presentation. So tonight we are joined by 2 frontline experts in the fight against COVID-19, Dr. Gail Newel, our county's public health officer, and Professor Marm Kilpatrick of UC Santa Cruz. So Dr. Newel is an obstetrician gynecologist with an extensive background in both public health and clinical practice. Newell's interest in obstetrics began when she delivered her first baby as a 19-year-old undergraduate while studying in Honduras. After receiving her undergraduate degree from UC Berkeley and attending the UC Irvine School of Medicine, Dr. Newel received a master's degree in public health with an emphasis on maternal and child care. From co-chairing the San Benito County Opioid Task Force to working as an OBGYN for over 34 years to serving on various legislative committees across the state of California, Dr. Newel is an expert in community health. After becoming health officer in Santa Cruz County in July of 2019, Dr. Newel has risen to the task of keeping our community safe and keeping new cases comparatively low in Santa Cruz County during this ongoing pandemic. So I'll go ahead and turn it over to Dr. Newel.
Well, thank you all, and thank you for the opportunity to join you all tonight. I am way, way older than 34. In fact, tomorrow is my 63rd birthday, and this is the last event that I'm doing before I take off for a few days. So it's my honor to be here. I do have kids in this age group, and so they keep me young and hopefully relational with the age group of the people on this gathering tonight. And thanks to everybody who has made this possible and this platform for connecting with people in the fastest growing age group for COVID-19 in our county. And I think I have a slide set if we can take a peek at that. And let's go right into the data. Nope. First of all, I'm going to tell you about our public health division for the County of Santa Cruz. And as the health officer, the public health division is the main area in which I work, although I work in all different kinds of areas of health and public health for the county. But I really wanted to point out that we are serving all of the community, and our vision of better health every day for everyone is reflective of our equity emphasis that we have for serving our population. So I think that's really important as we look at the COVID pandemic in our own community and the disparities and inequities that it represents. So we count you all as part of our mission and look forward to partnering with you this evening and beyond. So next slide. I hope some of you are familiar with this data dashboard. This can be found at santacruzhealth.org. It's updated almost every day. We sometimes take some weekend days off, but most days it's updated with all the latest data from COVID-19 in the County of Santa Cruz. And this is our data from today. So you can see across the top there, 1,030 cases. So this was a landmark day. It was the first day that we've had over 1,000 cases known in our community. Of those over 1,000 cases, almost 2/3 have occurred in the last 2 weeks. And that means that we have 2/3, 665 active known cases. And then the other 1/3 have recovered, other than the 4 deaths that we've had from COVID-19. Of that 1,000 cases, 74 of them, only 74, have required hospitalization during the time that they've had COVID. I'm really proud of our community. I will take a little bit of the credit for putting an early shelter in place because that really kept our curve flat for a long time. But this community has done so well complying with all of the social distancing requirements, because it's really those individual behaviors that give us the best outcomes. So wearing face coverings, staying 6 feet apart, minimizing mixing outside of your own household unit, and all of the other individual behaviors that we've talked about, and we'll talk about some more. So you can see that on this graph that we kept things relatively flat with only a few cases every day, 10 or so a day. That's very manageable until 2 weeks ago. And then suddenly we had this big steep increase in the number of cases. And you can see how that curve, that orange line, went straight up. So that's what we talk about when we talk about flattening the curve. And we did a great job of that from March until early July, and then no longer flat. Then if you take a look at the pie graph there on the right, half of our cases are still under investigation, and that's understandable since 2/3 of our cases are new in the last 2 weeks to us. But if you look at the other half, you see that in almost all cases, the way that the person got their COVID was from another person who's close contact, who we can identify. And that's what we do with our contact tracing and case investigation, is to try to figure out how each person got their COVID. And in almost every case in our community, we can identify a single person that infected another person who was within 6 feet for over 15 minutes and usually not wearing a face covering. So next slide. So this gives you a little bit of an idea about to whom and where these cases are happening. We're about 50-50 male and female, but look at the age groups, and you can see that the 18 to 34 year age group is by far the biggest group. And if you have been watching over time, you've seen that that group has gone from very small to by far the biggest age group. And almost all of our cases, see those big numbers down toward the bottom, 582 in the South County. So when we first had this virus in our county, it was pretty evenly spread throughout the county. It was a non-discriminatory virus. Now it's almost all in the South County, and there's a lot of different reasons for that. But a lot of them have to do with what we call the social determinants of health. So the housing is generally more crowded in South County. People are a little poorer. They're often essential workers, so working on the front lines, where that puts them at greater risk of becoming infected. And if you look at race and ethnicity, even though the Latinx population is only 1/3 of our county's population, they comprise well over half of our COVID-19 cases. And so there's a disparity right there. Again, more crowded housing, more frontline workers working in agriculture, service industries, stocking our grocery shelves, places where they have to be out with the public on a regular basis and exposing themselves to others. So next slide. So this graph, and I'm sorry it didn't quite transpose correctly here, but it shows the age group of our COVID cases over time. And the group we're talking about tonight, 18 to 35-year-olds, and hopefully that's most of you in this audience, are kind of an olive green color or golden color. And you can see that over time, that age group has really increased a lot, more than any other age group. And in fact, when we break it down from the first half of our pandemic to now the second half, we've seen close to a 40% increase in that age group from the beginning of the pandemic to now. And so why is that happening? Well, part of the reason we have you here tonight is to try to figure that out. But we know that you're out mixing with other households more, out in the public more, most likely, and so at greater risk of exposure. And next slide. So it's not only cases. So you've often heard that people in your age group, the 18 to 35, don't get very sick. So there's not a risk to getting COVID, right? So that's not actually bearing out to be the case in our own local data or elsewhere. But this is our local data, and this is the number of hospitalized patients. And look for that same color, that kind of golden color or olive green. And you see that almost none of the cases at the beginning of the pandemic were in your age group, and yet it's increased dramatically. And these are people who are requiring hospitalization during their illness. Next slide. So when we look at what kinds of exposures cause people to get COVID, it's pretty consistent that we're finding that, as I said, it's close contact, person-to-person spread. And if we look further at that, so we're looking now at the biggest slice of the pie and breaking that down further. These are all of our cases from the beginning, almost 300 of them, who had a person-to-person spread of their illness. And the majority of those, well over half, happened within their own household unit. So somebody in the house had COVID and spread it to other members of the household unit. And then another 78, so a full 25% or a quarter of the people got it from people outside of their household. So either extended family, family they're not living with, or their groups of friends. And then 45 people of the 300, so a smaller slice of the pie, got it in work. And 12 additional ones got it at work, but in healthcare. Now, in many of these cases, it's not in the work setting. In fact, I would dare say that it's very rare that in the work setting where people are doing all the precautions that they normally would do at work, you're not going to get COVID. But it's in the break room, where masks come off and people are eating together, maybe even sharing food, sharing utensils, sitting close to each other within 6 feet without face coverings, letting down your guard. That's where a lot of the transmission has happened. Or having a drink together after work, or taking a smoke break together. Those are the kind of things that put you at risk for sharing this disease. And next slide. So this is a sample of some of our clusters we've had, family clusters. And early on, we were able to actually look really closely at our clusters. And after Mother's Day, we had 4 family clusters that eventually involved 60 people. We were able to contain those and get them under control. And so the numbers in these strings of pearls here, the pearls represent individuals in a family cluster, and then the numbers in there represent their ages. And you can see that in many of our family clusters, we have multiple generations, 3 or more, and it's grandma and grandpa that get hit the hardest. And so those are ones that are more likely to end up in the hospital and more likely to die. Although, as we already said, nobody at any age is completely safe from that. Next slide. So a reminder that this is a big pandemic, and outside of our own community, the numbers are very different. So although we've only had 4 fatalities, statewide, we've had close to 9,000 as of today. And many counties have hospitals that are full to capacity and are needing to transfer their patients outside of their jurisdiction. Or are having to set up alternate care sites for hospital overflow. But again, look at the ages of the confirmed cases. This doesn't have the 18 to 34 broken down, but you can see that the majority of cases are in the 18 to 49 group. And next slide. So I hope that some of you have seen this map as well, and you can find this on the governor's website, which is covid19.ca.gov. And the orange counties are counties who are now on the monitoring list. And we just on Tuesday, that's just yesterday, joined the orange counties, and San Mateo joined today. So they were the last blue county in the Bay Area, and they have now joined as well. And it sounds like by joining, I'm saying that it's some kind of good club or something, but actually that means we've had more economic rollbacks, and I'll talk a little bit about those. But the important numbers to look at on this slide are the case rate. So where it says 324 per 100,000, we want that number to be under 100. For 100,000 people. And we just tipped over that 100 mark, and that's how we got to join the Orange Club. And we want our test positivity down toward the bottom to be under 8. And you can see that California is sneaking up there really close to 8. So not a good sign there. And so next slide. So here we look, if you go to the governor's website, you can click on a specific county and see your specific data for that day, or other counties if you're interested. And you can see that we have just increased our case rate. We're now at about 150. We want that below 100. And our test positivity is 5.9, and we want that below 8. So we're still okay there, but that has been climbing. And next slide. Again, the slide did not transpose well. I'm sorry about that. But Tuesday, as I said yesterday, Santa Cruz County was put on the state's monitored county list. And that means further closures to our economy. So the areas that remain open, there's many areas that remain open, but remarkable are that campgrounds and outdoor recreation remains open, because we know more about this virus now. And we know that outdoor activities are less risky than those indoors. Hotels are still open for tourism and travel. There's some contention about that, and that probably is responsible for some of our increased case rates. And then casinos are open because those are on tribal land and not under state jurisdiction. The closed operations, and many of these just happened on Tuesdays. So many indoor operations closed, but the outdoor operations can continue. So restaurants, for example, may continue to serve outdoors or takeout or to go, but there's no dining in allowed. Wineries and tasting rooms, outdoor only. Movie theaters are closed, but drive-ins with specific modifications are open. And I know that Scotts Valley is considering opening their drive-in, which could be fun. Indoor family entertainment centers like the Boardwalks Arcade and Miniature Golf has closed, and the bowling alley, but outdoor family entertainment is open. So outdoor zoos and museums are fine, but not indoors. Card rooms are all out indoors, so they are all closed. Gyms and fitness centers need to close all indoor operations, but they can move activities to outdoors. So you might be able to find yoga classes and Zumba classes and those kinds of things, maybe some fitness activities outdoors. Some personal care services can move outdoors, but they can't be held indoors. And that would include your barbershops, hair salons, and nails, and various aesthetic services. There are some personal care services that will not be allowed to be outdoors and will therefore have to close. So those include tattoos, piercings, electrolysis. Religious and cultural ceremonies need to move outdoors, including church services, weddings, and funerals. Shopping malls are only allowed for outdoor shopping malls, no indoors. So Capitola needs to close its indoor areas, although retail can stay open as long as there's a public entrance from the outside. And then offices that are not in critical infrastructure, and there's a list that the federal government has put out to define that, those need to go virtual again. And then one more thing is that protests also need to be outdoors only and not indoors, and other political activities as well. And next slide. So these are the areas that we'll be talking more about tonight, I'm sure, but the 5 pillars, the staying 6 feet apart whenever possible, unless you're with people in your own home or from your own home, household unit. Stay home if you have signs of illness. Wear your face coverings as indicated, and then frequent hand washing, disinfectant surfaces, and then covering your coughs and sneezes. And then something not on this page, but we're going to keep saying tonight, is minimize mixing and try to avoid gatherings outside of your own household unit. And I think I have just a couple of more slides, almost done. You may be getting a phone call that says COVID CA, It will usually come either from a local number, an area code 831 with a prefix of 454, or an area code 916, which is Sacramento. And this may be a contact tracer who's calling you to tell you that you may have been exposed to COVID. So please, if you see COVID CA on your phone, pick it up and talk to the person and help them do the contact tracing. And last slide, just a reminder that you can find all of these resources online at santacruzhealth.org, at covid19.ca.gov, and Facebook pages for County of Santa Cruz and Public Health Department. So also the CDC as well. So thank you all, and I'll be sticking around through the whole process here and available to answer questions later on.
Great. And thank you so much, Gail. Really appreciate all the helpful information and all the insight, and for all of your work and service to our community. It's much appreciated. It's been a difficult and unprecedented time, so I just want to say thank you so much. It's no coincidence that we in Santa Cruz have one of the lowest comparative case rates in the entire state, so thank you. And so now we'll be joined by Professor Marm Kilpatrick, who is a professor in the Department of Ecology and Evolutionary Biology department at UC Santa Cruz, and who is an expert in the field of infectious disease dynamics and population biology. Kilpatrick has done countless interviews and presentations regarding public health policy and stopping the spread of COVID-19. Kilpatrick has an extensive experience researching local drivers of pathogen transmission within communities and the impact of the infectious disease on host populations. He has also been published in over 107 academic papers, has been featured in the New York Times, the Washington Post, the San Francisco Chronicle, and many other publications. Marm, please unmute and take it away.
Thanks very much. So what I'm going to try to share today is a bunch of the science that scientists have been doing over the past 6 months or so to try to understand what I consider the most important details about COVID-19. And so I'm going to try to share some of that science with you today so that you're armed with the best information that's possible, and then you can use that to protect yourself and others around you. So Dr. Newel already explained or went through kind of the current status of COVID-19 in Santa Cruz, and so I'm not going to talk about this again, but what I'm going to do is actually zoom out a little bit and talk about what's happening at the whole state level. And so what I've shown on this slide here is actually the number of cases across all of California back since March. And so what you can see is that, unfortunately, like we've seen in Santa Cruz County itself, we had a little bit of cases back in April, and then we had a shelter in place, and then things were pretty good for a while, and then we had quite a spike in the last month or so. And then that rise in cases actually has given rise to an increase in deaths as well, and that's been quite apparent in the past just about 3 or 4 weeks in July. And so one issue that comes up a lot is people ask, is the rise in cases that we've seen, is that possibly just due to increased testing? And so unfortunately, that's not the case. And so if we look at actually the fraction of tests that are testing positive, the fraction of people that are testing positive, that's been basically flat or slightly increasing despite the fact that the cases are going up. So it's not just more testing. In addition to that, the number of hospitalizations is actually increasing a ton. So this little blue graph on the right-hand side of the slide here, basically you can see over the past little bit over the month, the number of hospitalizations in California has about doubled. So definitely showing a huge increase beyond anything we'd expect from just increased testing. I also want to make the point that COVID-19 isn't just something that happens in either big cities like New York City, where people have heard of, or across the whole state. It actually does hit small towns as well. And so the New York Times actually keeps track of each of the different counties across the US with the highest incidence. And in fact, the top 10 counties on that list, none of them are actually big cities. So this virus can actually definitely sweep through small towns just like it can big cities. So the question I really want to try to focus on mostly today is the science behind what we can each do to keep grandma and ourselves safe. And what that really comes down to is asking, how is the virus transmitted? So I want to try to share with you the science that we know that's happening for that. So what people have done to try to understand how the virus is transmitted is what Dr. Newel referred to a little bit, which is case investigation and contact tracing, where we basically go to a given person that's gotten sick and try to find out, how did they get infected with the virus? Who were they spending time with, and what kind of activities were they doing with those people? And so there's actually now data for thousands and thousands of cases across the entire world that have been investigated. And from this data, we can conclude several things. So first, the highest risk for transmission is when 2 people have sustained contact. So that means minutes of time spent together, not just kind of passing by each other in the hallway or out on the street, but actually spending several minutes together. We know that the closer the distance between those two people, the higher risk. So you've heard this kind of 6-foot rule or 2-meter rule probably many times at this point. And I want to clarify that a little bit to say that more distance is better. So if you could be 3 feet away, that's less risky than being 1 foot away, and being 6 feet away is better than being 3 feet away. So that's not a magical number, but that's a number that you get a substantial amount of safety by being at least 6 feet apart. In addition, we now have good evidence that if you're wearing a mask, that reduces the risk of transmission as well. And I'll talk about that a little bit more a little bit later. And then the other things we know now, which Dr. Newell alluded to, is that being in an enclosed space, especially with poor ventilation, also greatly increases the risk of transmission. And so if you think about these types of contacts and where these occur the most, of course, within your own household is the highest, right? So in your own household, you're spending substantial amounts of time, often hours with people. Usually you don't wear masks inside your own house. And so that means you don't have masks. You're often not making sure that you're always 6 feet or more away from someone in your own household. So that makes it a high risk as well. And then you're in an enclosed space. Sometimes there's, if it's cold out or something, you have poor ventilation. So that really makes households the highest risk for transmission. But there are other settings like that that also are very high risk. And so an example of that is being in a crowd with, in a crowded car with people. That's high risk as well. Any sort of enclosed spaces like buses, office rooms, restaurants, things like that can also be high risk when you have close sustained contact with people. In addition, we now have quite a bit of science that suggests that there are certain activities that increase the risk of transmission. And some of those that are listed here, which you probably heard some stories in the news about, are when people sing, when they yell, when they're doing vigorous exercise, or even just talking. And the basic idea there is that if you're basically doing anything that's increasing the amount of air coming out of your mouth, then that's also increasing the amount of small droplets that are coming out of your mouth, and those droplets have the virus in it. So anytime we're doing these activities besides sitting quietly, we're actually increasing the amount of essentially droplets that we're expelling into space in front of us. Things that are lower risk, but not zero, is if we were indoors, but we have space between people. So there's the numbers of cases that have occurred this way. There have been a few cases this way, but it's much lower risk than if you're close to someone. There's very few cases that have been traced back to brief contact with someone. So just kind of passing by them in the hallway, like I said a minute ago, or a brief interaction that just lasts a few seconds. Those are also much lower risk than these kind of long sustained interactions with people. So that's a hugely important contrast. And then it also turns out that there's a few cases that have been traced back to contact with recently contaminated surfaces, but those numbers are actually very low. And that's actually something that we didn't really know a few months ago. We thought this virus might be transmitted quite easily by, say, me touching my face or my nose or something like that, and then a door handle, something like that, and you touch the same doorknob, and then you might touch your mouth or your eyes or your nose and get infected. Thankfully, while that can occur, the risk for that is much lower than these direct interactions between people where you're actually spending substantial amounts of time, minutes, in close contact with someone, say within a few feet of them, and especially if you're in an indoor space. So the highest risk things we can do, we want to try to avoid those, and these are some lower risk ones that still carry some risk, but much lower risk. In contrast, as Dr. Newell mentioned as well, there's even fewer cases have been traced to activities where people are outside, and almost no cases have ever arisen where two people are outside and have some space between them or also have masks on. And so the absolute lowest risk we can get to is where we're interacting with people, where we're outdoors and we have some space between people. And if we add masks as an additional tool to that, then that really keeps us as safe as we can possibly be, except when we're inside our own house. And so if we kind of add these things all up together and we want to try to really minimize our risk, then staying safe basically means minimizing risk by wearing masks, increasing space between us and other people, increasing either ventilation or being outdoors. And then if we have to actually have a close contact with someone and we don't happen to have our mask or they don't have their mask on, if we can basically make that interaction a short duration, so just a few seconds, that will greatly reduce our risks. And then finally, of course, if we can, it's good also to not try to touch objects that everyone else is touching and then rubbing our eyes and nose. But thankfully, that's not as high risk as we initially thought it might be. So the highest risk things we need to really avoid are basically face-to-face interactions with someone where we're close to them, and we do it for multiple minutes, and we don't have masks on. Those are by far the highest risk activities, and we have a huge amount of science that shows us that now. So, so that's the how of transmission, and then I want to try to give you guys a little bit of the science on exactly what the differential risks are between people with different characteristics. Most of the people in the audience, if you're in the 18 to 34 category, then it's true that you're young and healthy, and your risk of dying is relatively low. I'm going to show you data for that in a minute. But as Dr. Newell showed, you actually can still get sick and the symptoms actually can last for a long time. And I'm going to show you data on both of those things. So this next slide shows what's called the infection fatality rate, or just the chance of dying given that you get infected with this virus. And so what you can hopefully see either from the table over here or these two figures on the graph is that if you look at age, which is on the x-axis here, and you look at the y-axis, which is this chance of dying given infection, your chance of dying, which are in basically these two groups here, are about less than 1%. So in fact, it's about 0.05%. So it's quite a low chance of dying given you get infected for your age category. Whereas in contrast, and as the title of this town hall gathering is mentioned, grandma, if grandma's either 50, in her 50s, or in her 60s or 70s, the chance of her dying given infection is much, much higher. And in fact, it can be up as high as 5 or 10%. In addition, we now have a bunch of data that suggests that the chance of men dying is actually higher than women. The exact reasons for that are not fully understood, but the data are strong enough that there's no disputing the patterns. And what that means is that although grandma has a really substantial chance of dying if she's in these kind of 50s to 70s or 80s category, grandpa actually has an even higher chance of dying. And in fact, it can be as much as 3 times higher. So in fact, men in their 80s have basically a 1 in 5 or 1 in 6 chance of dying given an infection, which is quite high. In addition to that, as you probably know, most of our grandparents also aren't just old, they also have additional illnesses. And so it's really hard actually to get old and not have illnesses as well. And these illnesses can additionally increase the chance of dying, and some of them by another factor of 3. So things like obesity, severe diabetes, and some forms of cancer can basically take all the numbers that are on this slide here and multiply them all by 3. So that's the chance of dying, and that's why we really do have to try to protect people around us that are older. And in addition to that, we actually also try to have to recognize that we ourselves can also get sick, even if our chance of dying isn't that high. So let me talk a little bit about the long-term illness that people can suffer. So you might think if you're 18 to 34, you get infected, you might have a little bit of illness for a little while, maybe a week or two, you're fine, right? So we actually weren't sure about this about 3 or 4 months ago. And unfortunately, we have a bunch of data on this now, and the answer is no. So there's now a really large amount of growing evidence that there's long-term effects of COVID-19. And in fact, if you get hospitalized for this virus, most people, 87%, so almost 90% of people, still have symptoms more than 2 months later. So there's basically really long-term impacts of getting infected with this virus. And the symptoms that people get, including people in the 18 to 35 category, are things like fatigue, trouble breathing, joint pain, and loss of smell. So basically people just feel terrible, and they keep feeling terrible for months and months after they've been infected. So it really is not just kind of like either a flu or a cold that you get over for a few days and you're fine afterwards. It appears to really do long-term damage to your many different parts of your body. So the next thing I really want to try to give you guys good information on is this issue, which is where we sometimes think if we feel fine, we can't spread the virus. And that's true for some things, but not for other things. And we really needed to understand that specifically for this virus. And I want to show you guys the data that we now have from a ton of scientific research that answers this question. And in fact, it gives a strong answer, not just for people in general, but actually specifically for young and healthy people. So it's a little bit of a complicated graph here, but I want to try to explain how it works. So on the x-axis here is the time since you became infected with the virus. So that's 0 here on the left. And then as you go forward in time, the black line here shows how infectious you are. And this red line shows when symptoms first start. So when you first start to feel a little bit of a fever, a little bit of a cough, maybe a little bit of a runny nose, any sort of symptoms like that. And what I want to try to make really clear, which is what all the data show, is that when we look back at people and they say, okay, you're sick, who did you possibly have contact with that you might have gotten this from? Were they sick at the time or not? And when we look back at those data, those case investigations and those contact tracing data, we find that, in fact, the highest chance for transmission actually occurs about 2 to 3 days before people are sick. So in fact, you're actually most infectious, or leading to most of the cases when you're not quite sick yet. You're going to get sick a day or two later, but you're actually already infectious. And that tends to occur a few days after you got infected. So basically, if you hang out with someone that's infected, you get infected, you'll feel totally fine for about 3 days. You'll actually feel fine for another 2 or 3 days. Normally, the average amount of time between infection and the first mild symptoms is between 5 and 6 days. So about a week later, you think, oh, phew, I hung out with my friend. He was feeling sick. I thought I might have gotten it from him, but it's been a whole week. I'm totally fine. Unfortunately, you can't conclude that. And what's even tougher than that is that even if you're feeling fine on days 5 and 6, you're actually at the peak of your infectiousness at that point, and you have a very high chance of spreading the virus. So that once the time you actually have some symptoms, unfortunately, you've already been spreading the virus for multiple days, on the order of probably 1 to 3 days. As it turns out, which is again interesting and comes directly from the science, your infectiousness actually declines after you start getting sick. So you're most infectious right before, you're still quite infectious right when you first become sick, but then as you get sicker and sicker, you actually become less infectious over time, which is a little bit interesting. One of the things that's tough about that is that the most severe symptoms of this disease start a number of days later, on the order of about a week after your mild symptoms. So symptoms like difficulty breathing, which of course is really not fun. Obviously a cough and a fever sucks, but difficulty breathing is really terrible. That's actually happening all the way out here. And the reason that matters a lot is because often if we have a mild cough or a little bit of a fever, we think, maybe I'm just tired. I won't worry about it. I'll still go to my job that day. I'll still go hang out with my friends that day. And if we do that, then of course you're right here at this peak of infection and you can infect your friends around you. And so what a really, really key part of Dr. Newell's whole public health team's efforts are that if we can basically get tested at the first sign of symptoms, so right here at this red line, then we can basically cut off all this transmission that can occur on those subsequent days. So two things are really, really important from this science. The first is that unfortunately, you can feel totally fine and be infected and infectious and infect your friends or your family. And if you wait until you've actually had your cough or fever for several days before you get tested, you've probably infected most of the people you're going to infect then. So it really helps to get tested as soon as possible and at the very first sign of symptoms. And I'm going to mention this again shortly. In addition, what this also really emphasizes is that because we can be infectious before we're actually sick, we have to wear a mask even if we feel fine. So you might think, well, if I can just spread the virus when I feel sick, I can just not wear a mask until I feel fine. But of course, this data now shows us that's not the case. We're actually infectious for 1 to 3 days before we get sick. And therefore, if we don't have a mask on those days, we can actually go on to infect all of our friends and family. Okay, so I want to show you a little bit of local data on Santa Cruz, from Santa Cruz, about whether or not people are getting tested right when they first get sick, or they're actually waiting a little bit longer. And unfortunately, it's not great news, and I think Dr. Newell already knows this. And so it makes a little bit of sense that you might think, I have a cough or a fever today, but I'll just wait a few days to see whether it just goes away on its own or maybe it's something serious. And the unfortunate result of that is that we can go on to infect other people. So what I have on this graph here on the x-axis is time, and the y-axis is actually the time between when we first get infected and we go on to get tested and we get that result back. And so we can look at two kinds of delays: the time between infection and getting tested, that's in blue, or the time between getting sick and getting tested, and that's actually what's here in red. And so the challenge is that both of these numbers are higher than we want them to be. So basically, it looks like in red here, people are getting tested about 5 or 6 days on average after they get sick. So they're waiting for almost a week until after they've had their symptoms to really find out they're infected with COVID-19. And as I mentioned just a minute ago on the previous slide, that's too late. So we basically need to push this red line down here towards 0 and get you to get tested as soon as you first have symptoms at all, even if they're mild, like a little bit of a cough or a fever. Let me say one more thing that's really important, which is that, as Dr. Newell said, if you get infected, then we're going to try to find out who you might have infected by this contact tracing team. And if you wait until all the way, let's say, a week after you've been sick for a little bit, then not only have you gone on to infect other people during those days where you felt fine and those first few days where you might have felt a little bit sick but not too bad, the people that you infected have actually themselves gone on to also infect other people by that time. Whereas if you get tested here right around the first time you get sick, we have a chance of actually finding the people you might have infected and getting them to get tested and then have them not infect anyone else. So this idea of breaking chains of transmission by testing people early on and finding that they're infectious before they've infected other people, that's really the key part of the whole public health operation. Okay, so one more consequence of this delay between getting infected, getting sick, going and getting tested a few days after that, and then the test maybe taking a couple days to give the results back, is that this really challenges our ability to know exactly what's happening at any given point in time. And so what I'm showing on this slide here is the x-axis is time, and the y-axis is the number of cases, which is the same slide as Dr. Newell was showing before, but I've added an additional line on top of that. So these bars here in kind of grayish black, that's the number of cases that were basically kind of reported on that day. But if we look back at those people and say, when did they get sick? And then we know that on average, if you got sick on a given day, you were actually infected about 5 to 6 days before that, and ask, when did those people get infected? That's what the red line on this graph shows. So in fact, if we look back in March, the first detections of cases, we thought were here in early March. But when we look back at those people and say, when did they get sick? And therefore, when did they get infected? Some of those people actually got infected back in late February. Similarly, this big spike in cases that have occurred in the past 10 days or so, you might say, wow, something terrible must have happened that led to a huge amount of transmission on that day, right? And the answer is no. In fact, those people whose cases were reported on that day, they were actually infected between 10 and 15 days earlier, somewhere around here where there's these spikes in this red line. And so what that means is that it's hard for us to know exactly what's happening today. And so it's good for us to look at the overall trends, which were kind of telling us what was happening, let's say 7 to 14 days ago. Unfortunately, as Dr. Newel showed clearly, and as both data sets show here, the trend is not good. So the transmission, the kind of numbers of cases was rising quite fast back in early July. And that's what gave rise to these cases that were detected in late July. And unfortunately, we're not going to know exactly what happened here until about 2 weeks from now. So these delays really hinder our ability to make quick changes and know the consequences of those changes right away. And so what it means is that if we see trends like this, we need to be especially careful. Okay, so one last thing I want to say that's directly applicable to people in the 1835 category is that some people, a certain fraction of people, it looks like the numbers between 20 and 40%, actually never get symptoms at all. So you can get infected, and actually it turns out, unfortunately, be infectious, but never get any symptoms at all, so you don't even know you're infected. And it turns out that the chance of that being the case, the chance of you having what we call asymptomatic infection, is actually substantially higher for young people. So people in your age category are up at the upper closer end up here to the 1/3 to 40% of people that basically will get infected, can be infectious and spreading the virus to people around you and never know you have it. And so that turns out to be really, really terrible. And it means you have to be really, really careful, especially in spreading the virus unknowingly to other people. And so, so what I've tried to make the point here is that you can accidentally spread the virus to people, especially people that might be, say, older, like grandma, who might actually go on to die. And so if we can, we need to be careful even when we feel totally fine. And so I'm going to say something a couple times, which I think is going to be a little bit of a tool that I hope we can all use to try to enjoy as much of our life as possible, but still be safe. And that's going to rely on what I said earlier about how we get infected. So if we're going to meet up with other people, we want to do it outside. We want to have a little bit of space between us and them, and we want to try to wear a mask. And we'll talk about that a little bit more again. So, so one thing I want to talk about in a tiny bit of detail is masks. So it's one of the tools we've heard a lot about, asking us to wear masks. And so we've sometimes heard confusing messages, and I want to try to clarify a couple things about masks. So one big question is, why do we wear a mask? Do we wear a mask to protect ourselves or to protect the people around us? And the answer is a little bit of both, but actually more of one than the other. So it turns out there's been a bunch of studies done to look at what happens if people wear masks or don't wear masks. And wearing a mask basically can cut your chance of infection by either a little bit, like 10%, or sometimes a lot by like 50%. But we can hopefully see from these numbers here, nowhere here is there 100%. So wearing a mask does not completely protect you from infection. And examples of that, of course, Dr. Newel showed a minute ago, which is where healthcare workers, which of course always wear masks, especially when they're working with infected patients, sometimes still get infected. So masks help, but are not 100% effective. Turns out their effectiveness depends on a few things. One is the type of mask, and the other thing is how well the mask actually fits you. And so this range here between being only a little bit effective for being quite a bit effective can depend on how well you're wearing your mask. And so that's an important thing to keep in mind. The other thing I want to say that's more important is that the real function of masks, besides protecting you a little bit, is protecting the people around you. So there's now a huge amount of science that shows, and not surprisingly, right, that if you have a mask in front of your face and you're either talking or breathing, or especially talking loudly or singing or anything like that, that the amount of kind of droplets you're expelling when you do so is quite substantial. And if you have a mask in front of your face, that's going to stop most of those droplets from getting out into the space around you. And so depending on the type of material that's in your mask, it can reduce the amount of these droplets by a substantial amount, often higher than 80%. So masks can be quite effective at protecting the people around you, even if they're only protecting you a little bit. So if we know this stuff from the science, you might ask, why did we get this mixed messaging where back in March and April, we said, well, we're not sure about masks, don't worry about it. And then now we're saying everyone should wear masks. The reason that we had a little bit of this mixed messaging is that early on in the pandemic, and unfortunately still somewhat now, there was a huge shortage of having enough masks for healthcare workers. So there's a couple kinds of masks, one called surgical masks, which are those blue ones you see people kind of wearing around, and there's a slightly fancier mask that some healthcare workers wear when they're working with really infected people. And there basically weren't enough of these masks to go around, and there was a concern that if people bought these masks, there wouldn't be enough for the healthcare responders. And so we didn't want to have that happening. In addition, the CDC knew, because they'd read these studies, that the masks themselves are not completely protective. And there was a concern that if we said, hey, everybody wear a mask, people might think, if I wear a mask, I'm totally invulnerable and nobody around me can get infected. And they were worried that that might actually encourage people to have even more dangerous activities than they would have otherwise. So that was some of the concern that led us to not initially suggest wearing masks. In contrast, what happened was we found out that it was really quite possible and frequently happened that people that felt fine spread the virus. And the combination of realizing that you were infectious before you were sick, which the fancy name for that is called pre-symptomatic transmission, the realization that was really, really important, suggested that wearing masks, even when we feel fine, would be really important. That would actually overwhelm any sort of concern about mask wearing changing our behavior and making us be a little bit more dangerous. And of course, what they've highly encouraged now is us wearing a mask of any kind, even if it's one that's say not one of these surgical or doctor's masks. And so that's where we got here on the masks thing, and that's why masks are really important. It's partly because they protect you, that's this number one up here, but it's even more important that they protect the people around you from you infecting them, especially when you feel fine, but obviously as well when you're feeling sick. So that's the key parts of masks. Okay, so the last part of my talk here is I just want to talk about how to do some of the things that we all want to do, but at the same time keep other people around us safe. And so, for example, if we want to go visit our grandma or uncle or mom or cousin that we don't live with, how can we do that safely? And the answer is, probably not surprising at this point, we should meet them outside. We should keep a little bit of space between them, between us and them. And if we have to meet them inside, let's say it's raining or something like that, then we need to have space between us and have a mask on. And if we can, as much as possible, also have good ventilation. So that means opening windows, things like that. If we can hang out in a screened-in porch, that would be great as well. If we're going to stay with someone that we don't normally live with, then there's a chance of us infecting them. And the ways that we can try to keep them safer are, if we can, to stay in a place nearby, so in a hotel room or something like that. If we can't afford that, we can be a little bit crazy and we can actually camp in their backyard. That's a totally safe way to basically not be in the same indoor space with them. If we do have to be inside of the same building with them, then it's important for us to try to not be in the same room with them. And so that we can obviously, let's say if we had to stay in a room at their house, we could try to not have them in our room or us in their room, and basically try to spend most of our time with them in an outdoor environment with some space and masks on. So you might then ask, what if it's a birthday party, either yours or theirs, and you want to try to celebrate it? Again, if we can have those celebrations outdoors with space, and as I said before, a mask, and especially if you're indoors. Of course, if you're eating either cake or barbecuing or having a drink or something like that, you can't have a mask on. So what does that mean? It means if we can, let's do those kinds of activities outdoors where we can have better ventilation and a little bit of space between us. So those are the ways to try to use these multiple tools we have to enjoy these kinds of activities. There's some other things that I think that people want to do, and I want to try to give people tools for making those safe. So what if you're at work and you want to grab lunch with a friend? Or what if you have a friend you haven't seen in 3 or 4 months, you really want to get together with them because you haven't seen them? How can you do that safely? I would say the safest way to say grab a meal with someone that you don't live with is to get takeout. So don't go to kind of get food inside their house or inside your house, but grab food, either get takeout or make your own food at your house, meet them somewhere, ideally like in a backyard or an outdoor area, and then set up either a couple lawn chairs or something like that, 6 feet apart, and have your meal and hang out. And that's the way that you can actually interact with someone that's not in your household and really keep the risk of you transmitting the virus to them really, really quite low. And that's by using both outdoor spaces and by having space between you. You might ask, what if I need to ride to the beach, or my buddy needs to ride to the beach that I don't live with? How can I keep them safe? Being in a car with another person, especially, is not a great, it's a moderately high risk activity. So what are things we can do to make that lower risk? And the answer is, we can roll the windows down. That gives us more ventilation. That's a good thing. We obviously can both wear masks, both us and the person we're giving the ride to, or the driver plus us if we're the one getting the ride. And it'd be a little bit silly, but it actually would help quite a bit if the driver can be in the driver's seat and we can actually be in the back right seat. So pretending that you basically have a chauffeur. So it's a little bit silly, but those 3 things are the ways that you can basically give people a ride or get a ride with someone to the beach while keeping the risk of transmission much, much lower. Now, of course, if the windows are down, it's going to be chilly, so make sure you have a hoodie or something like that to keep you warm. A bunch of folks in the 18 to 35 age category want to play a ton of sports, and it's been tough not to be able to play sports. And so you might ask, can we do these things safely? And I'm going to say that some sports is hard to do completely safely, but there's some things we can do to reduce the risk. So obviously with all these things, outdoors is way, way better than indoors. So that's hopefully you guys get that at this point. In addition, if it's possible to do sports that have some space, that's better than others. So for example, volleyball would be safer than basketball because of course the 2 teams are separated by the net and it isn't that often that you're that close together. In addition, there's a term that people are using these days you may have heard of called cohorting. And the idea there is just where you basically, the fewer people that you have close contact with, the lower your chances of getting infected. So if you're playing volleyball and you had basically everyone on one team lives together, you're already in the same household, then that's going to be better than having mixed households on the same team. Similarly, let's say you were going to play basketball. The safer way to do it, it's not going to be possible to make that super safe because, of course, you're having quite close contact with somebody and you're both exercising and breathing in each other's faces. So that's going to be moderately high risk. But a way to keep it safer is that rather than you, say, guarding a different person in each one of the different points where you're actually going to be having contact with multiple different people, if you basically picked one or two people to only guard for the entire day, that would keep your risk lower than it would otherwise be. Okay, so the last things I want to say are that COVID-19 impacts us in a number of different ways. So one is the chance of us ourselves getting sick and infected and possibly dying. I showed you data today, and you probably already knew that the chance of people in 18 to 35 category dying is quite low. However, as Dr. Newel showed, your chance of getting infected and getting sick, and even sick enough to go to the hospital, are not actually zero. It's actually quite moderate. And then your chance of actually having long-lasting illnesses is also substantial. So that's a reason to worry about it for yourself. In addition, I showed you data today that the chance of older people dying is much, much higher. And so to protect our grandmas, we have to be careful as well. So in addition to the public health impacts of both to yourself and to people that you love around you, there's been huge, huge impacts to our economy and to people's jobs. And so one of the things that I think has not been fully appreciated is the connection between what happens, what we choose to do that might put us at higher or lower risk, and not just the health impacts of us, but the effects of that on our own jobs and our friends' jobs. So as Dr. Newel said, just this past Tuesday in Santa Cruz, we lost a bunch of businesses, or a bunch of businesses had to close because the number of cases is rising too fast, or is at too high of a level in our county. So a couple weeks ago, we had to have all restaurants close their indoor operations. Bars actually are completely closed for indoor and outdoor operations. Theaters are now closed. Breweries are closed. So all these things that a bunch of us love to do are now closed because the cases are too high. And so that's both a bummer for us because we don't get to enjoy those things, but it's also a bummer because the people that work at those businesses actually don't have jobs anymore. And so, so there's a good chance that either one of you guys or your friends' jobs may have just been cut or might have to be cut relatively soon. And so I think that's a huge bummer, obviously, for each of those people that are losing those jobs, in addition to the public health impact of being sick or possibly dying from this. I just looked up, unfortunately, in Santa Cruz locally, a bunch of businesses have actually not just closed temporarily, but a number of businesses have actually said that the closures over the past few months have been so difficult financially that they've closed permanently. So I've just listed a few of them here of places that I've actually gone in Santa Cruz myself, and that some of you may have gone to also. And so the longer that we have this virus being transmitted rapidly in our community, the longer these businesses will be closed, and the more and more that will actually go out of business permanently. In addition, you may or may not know that schools in Santa Cruz County and actually throughout California, excuse me, can't be open in person if there is rampant transmission in the community. And so if we want our kids in our community to be able to go to school in person, we have to have the transmission in the community much lower than it currently is. And so that's another reason for us to try to make good decisions in terms of keeping risk low, because that actually helps kids go to school. So again, I'm going to try to say this a few more times. If you can, if you're going to meet up with a friend that you don't live with, that's outside your household, meet outside, give some space, and wear a mask. So the last thing I want to say is that there's a good number of people on the calls today, which is fantastic, and I hope I'm trying to give you the information that you need to keep yourself and grandma and people around you safe. But we need a lot more people to actually be able to make this connection between this virus and transmission and getting together with people and the ways that we get together with people and the impacts of that on our overall community. And so I hope that people that are on the call today can reach out to your friends and let them know that it's not just the risk of you getting sick, it's actually the impact of, let's say, your grandma getting sick, which is obviously a chance for death or severe illness is much higher. But in addition to that, it's all of the people's jobs that we're also losing that then don't have a way to buy food or pay the rent and things like that. So if you can encourage all of us and our friends to basically meet outside, give some space, and wear a mask, that will help us all together. So that's all I have for today, and I hope we have some time for questions and answers.
Awesome. Thank you so much, Marm. Thank you so much, Gail. Both your presentations were very thorough and wonderfully informative. So we have about 30 minutes left of total event time, and we've got a number of questions queued up. So I'm just going to begin kind of shooting some of these at you. Feel free to take them however you will. If I think one of the questions is probably more suited to one of your answers, then I'll go ahead and queue it up for you. So to begin with, a really quick question. What are the common symptoms that people are experiencing when they first contract COVID?
Well, if you remember back at the beginning of this all, January, February, March, we asked people to check for fevers, coughs, and difficulty breathing. So this is a lower respiratory virus, so usually not sore throats and sniffles. But now we know that this virus can present with a lot of different kinds of presentations. And as Marm said, it can be 20 to 40% of the time, no symptoms at all. So that makes this virus very tricky. It's a very successful virus for that reason. And we know that there's all different kinds of ways it can present, including stomach upset, nausea, some diarrhea. A very common symptom that we don't get asked about much is loss of smell or taste. So some doctors now, and some places you might get screened, may ask you to scratch and sniff some little cards and ask you what you're smelling on those cards. And that's a way to check for loss of smell. And that's gaining some traction as maybe a screening method that might be more successful than fever, for example. So many different kinds of symptoms.
Okay, thank you so much. Let's go ahead and take another question. This is definitely going to be one for you, Gail. Someone asking about the beaches being open for the 4th of July and how that decision was made. Can you just talk a little bit about that? And also, if you want to add in, what is the actual transmission risk of going to the beach?
Yeah, so the beach order was never really about the beach. And I know this is everybody's favorite topic, so happy to be talking about it again. Beaches are not dangerous. Early on, there was one article that got a lot of attention in San Diego. A physicist who studies movement of particles in water and was saying that perhaps COVID-19 is spread and that she didn't recommend that surfers or swimmers go out in the ocean. That's been totally disproven at this point. And the ocean water is safe. This virus does not reproduce or survive in water. And so we know that water sports are safe. Being out in the ocean is safe, surfing, ocean swimming, and even being out on the beach, as Marm said, is a very low risk activity, any kind of outdoor activity. And it's so good for us both physically and mentally to be out in the great outdoors and all of the beautiful areas in Santa Cruz. So I want to put that to rest right off the bat. And then, so the reason that we did that 6-hour closure in the middle of the day for a number of weeks was to disincentivize tourism. So we were really trying to discourage especially people from our neighboring counties from coming over and spending the day, not because the beach was busy, but because their surrounding counties, our county was doing so much better than their counties in terms of disease that we were concerned that our neighboring counties, Santa Clara, San Mateo, Monterey, Central Valley counties would bring in a greater disease rate into our community, and in particular in our indoor spaces. So not so concerned about the beaches themselves. And we didn't know as much about the virus then as we do now, so it's become clear that the beaches themselves are not risky. The reason that we closed the beaches, there were a number of different factors, but the main one was because once the governor opened hotels and vacation rentals and started promoting tourism and said that despite the stay-at-home order, which by the way is still in place, we could start traveling outside of our own county, and it was okay to book a hotel or go camp in a campground outside of your own jurisdiction. It just didn't make sense to then dissuade tourism by closing our beaches. So I hope that answers the question.
Great. Yeah. Again, very thorough answer. Just queuing up some of these questions. When will we begin focusing on immune health and proactive health-related strategies that the community can employ? Take that as you will.
You want to take this one?
Sure. Yeah. So one of the big unknowns from the science side is still this interesting pattern where even for a given set of the population, so even if you take a given decade of people, and even if you remove pre-existing health conditions, we actually see a huge variation in the potential, in the different severity of the illness. So if you basically take a 50-year-old, take 150-year-olds, some people in that 50-year-old category, none of which, let's say, have any pre-existing conditions, some will actually get the disease, get infected and actually not have any symptoms at all, so totally asymptomatic, or have very mild symptoms. And another 50-year-old, again, that doesn't have any diabetes or cancer or things like that, will go on to die. And so a huge question there, of course, is what's driving this variation in the severity of the disease? And unfortunately, the science, as far as I know, and I've been reading stuff literally even this morning, is we don't fully know. There's a little bit of evidence that suggests that that previous exposure to other coronaviruses, we know actually helps our body make certain things in our immune system called T cells. And there's a little bit of evidence that some of those T cells can actually cross-react with this virus. So I would say that's one of the leading hypotheses without slam dunk evidence, but it's out there so far, as a possible reason for why there's differences in severity of people not just say linked to age or pre-existing conditions, but other characteristics. So that's actually not a good answer to, I think, this question, which is what can we do to keep ourselves, say, our immune systems up? And I think obviously Dr. Newell already said, if we can basically do healthy things, eat good, get some exercise, get some time outside, things like that, those are all good things to keep our immune systems healthy. But what I did want to say is just that, unfortunately, those things are not enough to guarantee ourselves not getting very sick with this virus. So the point I was trying to make is that even people that are very healthy, that are doing all the good things, still are getting very sick and dying of this disease. And we can't predict whether we're going to be that, say, 10% that dies, or the 80% that doesn't die. And slight differences in, or not even slight differences period in, say, how much exercise we get or things like that, do not appear to explain any of that variation. And so while it's definitely really important for us to do all the healthy things, we should not think that if I'm a healthy, whatever X-year-old person, I'm therefore totally immune to this virus. It has now shown us that people that are in the absolute prime of their life, say a 35 or 40 or 50-year-old person, totally healthy, exercises all the time, eats great stuff, can still get really have almost their entire body damaged by this virus. So we now know it actually infects not just your respiratory system, but it impacts your heart quite a bit. As Dr. Newell said, it can impact your digestive system. It really attacks our entire body. So it's important to do those things, and I would highly encourage people to be as healthy as you can, but I would also encourage you, despite trying to be healthy, to also take very clear things that we know to do to keep the virus outside of our body. So those things are no substitute for just keeping the virus outside of our body.
Great. Very, very thorough. Much appreciated. Coming to terms with my own mortality here. So, a couple of questions that I'm seeing themed in the chat. So one is related to deaths, and if we could talk more about who are the folks in our county. Obviously want to respect people's privacy, but who are the folks that ultimately passed away as a result of COVID, and then also the different clusters and vectors of transmission. You guys, especially Dr. Newell, you mentioned some clusters that you guys are tracking with some multi-generational family households that resulted in 60 cases. So I know it was kind of two questions, but that'll handle some of the chat box backlog.
The deaths that we've had in our county, all four of them fall into high-risk categories. So they all were older, they all were sick with other chronic illnesses, and at least two of them were also obese. And so the risk factors were there, but again, you can't count on safety based on 4 cases. And so as Marm has said, any age could end up hospitalized, any age could end up dying, but the older folks with chronic illness are definitely more at risk. And then as far as the family clusters, they were multi-generational extended family gatherings for Mother's Day. And this year was a particularly bad Mother's Day for disease transmission, because as I understand it, I think in the Hispanic community, Mother's Day always falls on, I think it's May 10th. And May 10th this year was a Sunday, so it was kind of a double whammy. And there were lots of family gatherings, and the family clusters we had were all in Latinx families in the Watsonville area. They were all extended family over multiple generations, multiple households. They were together, often indoors for all day, not wearing face coverings, sharing food, sharing utensils in some cases. So very high risk activities.
Okay. Anything you want to add, Marm?
I think that's great. I think the challenge is just, I think maybe the one more thing I would add to that I think we're seeing quite a bit of is, I think people initially recognized the pandemic as an important threat, and we thought, okay, we'll do the shelter in place, we can do this for a while. And then I think unfortunately people became really tired of it at some point. And the problem is that even though we're all tired of the shelter in place or any of these restrictions, the virus doesn't really care about that. And so the virus doesn't really mind that we're all sick of not being able to hang out with our friends and do all the things we would normally want to do. It's going to spread just as much. So I think that was also part of the challenge, at least as I saw it, is that I saw as soon as the state started to lift some of the restrictions on us, I think that was a signal in some of our brains to say, phew, that was a bummer. I'm so glad to get to start doing the things I really like to do again. And unfortunately, nothing changed about the virus between March when we had the shelter in place and May and June or July now. The virus is just the same virus. It still wants to go from my lungs to your lungs to the next person's lungs. And so if we give it that chance, it's going to take it no matter what.
And unfortunately, that big economic reopening happened right at the time of year when we have all these celebrations. So graduations and Mother's Day, and you know, it's a big time of year for weddings and all kinds of family reunions, and then Father's Day and 4th of July, Memorial Day. So, and it's also beach season and summer, and people just had that itch to get out and about and do all the fun things they did before COVID. So I agree with everything you've said.
Gotcha. Okay, again, trying to get at some of our backlog of the chat questions here. So there's two big themes. One's related to testing and one's related to effective use of masks. So let's go with the testing one first. I think it's a super pressing issue. Lots of folks are asking, you know, are there shortages of testing supplies? Are there delays in testing? What is the current timeline for going and getting testing? When should you go get tested? I know it's a lot of questions, but I'm sure you've gotten them many times. So just take it away.
Let me take the first easy one, Dr. Newell, then you can take the hard ones. The first easy one is that if people can, and Dr. Newell will talk about capacity in places and ways to do this, but if we can basically get tested that first day that we have a cough or a fever, that's going to be the most protective thing for you, the person, for the people you live with, and all the people around you. And so we can definitely have a huge impact from public health if we can get tested on that first day or two when we first start getting sick. If we really say, it's a cough or a fever, I'm just gonna, you know, I'm a young person, I'm tough, I'm gonna stick it out for 3 or 4 days, and if it sticks around, then I'll go get tested. If we do that, unfortunately, on those 3 or 4 days, the chance we infect our household members, any people that we might work with, any people we might spend time with is substantial. And in addition to that, because of course, if we're sick now, we actually have been infectious for 3 days already, and the people that we infected already themselves, they can go on and infect people before we make the call and tell them, hey, you might be infected, please come get tested. So the faster we can get people to get tested when they first have the first symptoms that generally show up in the first day or two are these milder symptoms that unfortunately are kind of general, right? I don't know about you, Dr. Newell, but I have a little bit of allergy things. And so each day I wake up, I'm always like, is that a sniffles or is that just my allergies kicking up? And so you do have to make some sort of distinction, right? But when you have a pretty good feel, you think, no, a cough is not just a cough from something in my throat, it's actually a cough, or actually I feel kind of a little bit feverish. If you can get tested that day or the next day, that's gonna help protect everyone around you, and the people that you might have infected, protect all the people around them. So basically it has a double whammy effect. So the earlier, the better. And so I think that's the very clear science in public health from that side. And I'll turn over the very tough question for Dr. Newell about where we're at, where they can go, and what the delays are.
Right. So if you want to get tested, and you should want to get tested on your very first day of symptoms, the best way to do that is to call your primary care physician's office or your primary care provider. And don't go in, wait till you talk to them, because they don't want sick people walking into their waiting room. So call your healthcare system that you're affiliated with. If you don't know, call your health plan. So if you have Medi-Cal, for example, there's a phone number you can call on there. and you need to be seen that day. All of the healthcare systems have respiratory clinics, they call them for the most part, and it's usually a series of tents that are outdoors because, again, that's safer for everyone involved. Some places actually will let you stay in your car and will come see you in your car and swab you in your car. And most of our healthcare systems have some kind of testing that you'll get that test back in a 1 to 3 day time period. If you're sick like that, we don't want you going to Ramsey Park to get the free testing. First of all, there's about a 3-week wait to get in there, and then it takes about 2 weeks for you to get your results. That's not going to help anybody. You're not going to get your result for a long time till you're way past and you've already spread it to all your friends and family. So we don't want you going there if you feel sick. So the best way is through the healthcare system. Right now, there is a shortage in the entire globe of the chemicals or reagents needed to run the tests. And so you may not, if you're well and are just curious about your COVID, or if you're well and you've been exposed, you're afraid, then you might not be able to get tested. And that's because there's this global scarcity of these reagents or testing chemicals. We're working here in Santa Cruz to solve that locally by working with UC Santa Cruz and their genomics lab. And Marm is a big part of that. And so we really value their partnership because they're going to save our county at this time when we otherwise couldn't be getting testing.
Awesome. And one follow-up question, because I've seen this in a couple of comments so far. How accurate are the current testing protocols? And can you talk about the difference between getting a nasal swab versus, say, an antibody test?
You want me to take that, or do you want to cut it? No?
Yeah, you do it.
Okay, sure. Yeah, so the swab test, which is the kind of gold standard that people have been doing for just when we first started doing the testing for this, is basically taking a longer version of a Q-tip and putting it up your nose and into kind of a little bit further back than you might know that your nose normally goes. And so it tickles a little bit. It's funny, I've actually been swabbed for a couple of our research projects, but that's the standard technique. And that technique turns out to be very, very effective at finding the virus if the swab is put in the right place in the back of your nose and right around the time that you actually first start having your symptoms. So on that first day that Dr. Newell is suggesting you go get tested, the other big reason to get tested then or the next day is that the chance of finding the virus, given that you're infected, is actually the highest. Unfortunately, it turns out we now have a huge amount of data that shows if you wait, let's say a week, because it's just a cough and a little bit of a fever, and you can totally handle it, and you wait 5 days, the chance you pick up the virus through the swab test actually goes down substantially. And by day 10, I think it's down to about 50 or 60%. So the chance that you actually miss the virus, even though you're infected with it, if you wait, let's say, till 10 days after you first had your symptoms, is down to only about half the time. So it's really quite effective early on and not nearly as good at basically finding the virus till later. So that's actually created a bunch of problems. And if people in the audience have heard of stories of this person went to the hospital, they had symptoms, the doctor was pretty darn sure it was COVID, they swabbed them, that came back negative, they tried the next day, they swabbed them, they were negative again, and then the third day, finally they were positive. That's what we're talking about. So that's basically where the virus in the later stages can become hard to pick up with this swab technique. So, so that's yet another reason to definitely get tested as soon as possible after you have your first symptoms, because that's their highest chance of picking up the virus. So the other thing that I will say is that you can actually also be more or less successful in picking up the virus depending on exactly the swabbing technique. And I think Dr. Newell had lots of conversations with her team about trying to make sure we do good technique with the swabbing, because basically if you don't get all the way back with the swab, you can sometimes miss the viruses in the back, but not so much in the front. And there's some good science behind that as well. So, so there's definitely a little bit of variation from swabber to swabber in case of your technique for swabbing. The last thing I want to say is to answer the antibody question. So that swabbing technique where they try to put something in your nose, or occasionally there's actually some new techniques now where they're going to be using some either mouth swabs or a little saliva. That's actually being done now as well as some tests in your nose, but not quite so far back. Those tests give up a little bit of accuracy in that they can miss some of the lighter infections, but they tend to not miss the really heavy infections as much. And that's actually good that they don't miss those ones, because the people that are actually most infectious will have the most amount of virus in their nose. So some of these other tests that are a little bit less, I guess, invasive, if we want to call it that, in our noses, are not quite as good at picking up the really low-level infections, but actually quite still good at picking up when you're quite infectious. So that's actually why a lot of frequent testing operations are moving to some of these slightly easier to do techniques. In addition, because as Dr. Newel probably knows, unfortunately probably with our team firsthand, your chance of the nurse getting exposed to the virus is much higher if you actually have to have a nurse poke a swab all the way up someone's nose, which can sometimes irritate you and make you either sneeze or cough with the public health person. So that's obviously risky for that person as well. Whereas some of these other techniques are actually lower risk for the public health care provider as well. So those tests look for actually the virus itself and whether or not you're infectious and can infect someone else. There's another kind of test out there called an antibody test or a serological test. And those tests actually are not for whether you're currently infected, but they're for actually whether you were infected in the past. And so those tests are trying to ask, does your body have antibodies, these little proteins our bodies make, that are kind of evidence of past infection? And so those are a little bit helpful and actually sometimes quite helpful in trying to understand the epidemiology of the virus, which populations might have been infected more than others and things like that. But they're actually not useful at all in finding out whether you're infected now and actually can go on to infect people, because our bodies tend to not make those antibodies until about between 10 and 15 days after we've gotten sick. So when you're long since not really infectious anymore, that's when you first start making these antibodies. So that test is actually totally ineffective for finding out whether you're infected today. In addition, it turns out none of the tests out there for the antibodies themselves are 100% perfect. And that means that if you take a test and you get a positive result back, you might think, ha, I was exposed that time I was sick. I've had the virus so far. Now I'm totally immune. I can now not worry about it, go hang out with my grandma, go party with my friends, whatever. It turns out that no, all the tests that are on the market, I've actually looked at all the data really carefully. No test is 100% perfect. And there's a chance that you can get a positive and actually not have been exposed and not actually have antibodies to it. In addition to that, which is probably even more frustrating, we don't yet know from the science side, if you have antibodies, whether you're protected from infection. There's basically not been enough time yet to know whether or not people that say got infected in March when our first cases were, is that person now, let's say, immune, or actually are they not fully immune anymore and they actually could get infected again? We don't have strong evidence that you can yet, but I will say that this virus is called a coronavirus. That's the type of virus that it is, and that's why people have probably heard that term a bazillion times now, more than you ever did. Other types of coronaviruses, we actually lose our immunity to them relatively quickly. So there's actually 4 common cold viruses in the coronavirus family that actually we get kind of every year. They're passed around all the time. They're very mild, but we actually lose immunity to those individual viruses on the time span of about a year. So there was actually, I don't know if this will be gruesome for some of the audience members, but I'll say it anyways. There was actually a study about 15 or 20 years ago, is that right? Maybe a little longer. Anyway, a few decades ago, where they actually got volunteers to come get experimentally infected with these cold viruses, not with this current virus, but with cold viruses. And they had those same volunteers come back a year later and tried to infect them with the exact same virus that hadn't mutated or anything, had been stuck in a freezer and kept the same way it was. And a fraction of those first people could be reinfected again just 1 year later. So I bring up that example to say that we don't know whether infection with this new coronavirus we have now confers long-term lasting immunity or short-term immunity, and we don't actually also know whether previous exposure gives us fully protective immunity that we can't get infected and can't get sick, or it just makes the subsequent infection milder. Those are all still giant outstanding questions that we don't have data on now. So I would highly encourage people that if they do go get an antibody test and it comes back positive, you should say, those symptoms I had before, they were probably COVID-19, and I should still try to make sure that I'm careful not to get reinfected again, because I could get infected again possibly, and I could go on to infect someone else. And we don't actually know yet that the antibody test tells us anything about that problem. So hopefully that tells people what they could do usefully with that information, and also what they should not overreach in terms of being confident about what that antibody test means.
Awesome. Thank you so much for that answer, Marm. I think it addressed a lot of people's concerns, because we saw a lot of questions in the chat about, if I got a positive test, can I still transmit the disease, or can I experience symptoms in the future? So I'm glad you addressed that.
The answer, unfortunately, is we don't know yet. We don't really have that answer.
So better be safe than sorry, right?
Absolutely, yes, that's exactly great.
Yeah, and then another thing I've gotten about testing delays and the worry about if folks don't have insurance. So 2 questions. When will UCSC be helping to pick up a lot of the testing burden, since we are going to be losing Ramsey Park at the end of the month? And if people aren't experiencing symptoms or don't have access to health insurance, is there a way they can get tested and have a reasonable time frame to get the results back, so that I can hopefully stop if they have a positive case?
I'll defer that one to you, Dr. Newel. That's a hard question.
And I have to admit, I was reading questions in the chat box, so I missed that question. You'll have to say it again.
So when will UCSC be taking up more of the burden of increasing testing? Because we are going to be losing Ramsey Park soon. And if someone doesn't have a primary healthcare provider or access to insurance, where should they go to still get a test?
Great question. I meant to say that before. First of all, Ramsey Park's with us through August 31st. So we have another, a full month with them still. And we are working with our safety net clinics to pick up the community testing that Ramsey Park has been offering now. So we have a big chunk of money from the federal government called CARES Act funding. And we're going to be able to use that to share with our safety net clinic partners to be able to do additional testing. And so that's where people can go. If they don't have insurance of any kind, they can present to any of the safety net clinics. So that's Salud para la Gente, Santa Cruz Community Health, Planned Parenthood, and our own county clinics in both Watsonville and on the Emmeline campus. So if they call ahead and let people know, they can be seen on a sliding scale, in many cases for free.
Can I add one more point to that?
Yes.
So one thing that comes up a lot, which I think is unfortunate, but this is the reality of it, is that if you want to go hang out with grandma, right, and you don't want to kill grandma, and so you're like, well, I did some things in this past week that I wasn't super sure were great ideas, but I want to make sure I'm not infected and then go hang out with grandma. It turns out, unfortunately, that taking a test, and if the test comes back negative, that actually can't rule out infection. And the reason for that, which is a tiny bit complicated, but I'm going to try to say it because it's a really important issue, is that when the virus goes into our body, for a few days, it actually replicates at low levels and we can't pick it up by the swab. And so we know that it can get down in our lungs, basically. And as maybe some people in the audience know, that if we have to make sure we're not infected, the main thing we normally do is quarantine for 14 days. And the reason we wait 14 days is that it sometimes takes people 14 days to first have symptoms at all from this. And what that means is that the virus can basically be in your lungs at low levels and not really doing much for several days. It's probably replicating, but just not at a high enough level to pick up and not enough to make you sick yet, but for quite a long time, like 10 days or 14 days. And what that means is that if you got sick, let's say 6 days ago, and you get tested today, you may get a negative test, and that may mean that you're actually probably not infectious at the moment that swab was taken from your nose. But it's actually still possible that the virus was in your lungs from that maybe party you went to or hanging out with your friends 6 days ago. And tomorrow, the virus will be a little bit higher than it was today, and the same thing the next day. And then on day 10, let's say, it's actually then you're actually quite infectious and you get sick on day 11. So we actually have good data now to suggest that tests early on, just after you're infected, actually have a decent chance of actually missing the virus. So one should, if you get a test and it comes back positive, there's an extremely high chance you were infected, and you should take all the precautions that are normally in place, which are basically isolating and trying to not infect all the people around you and all the kind of things you probably heard about. But what I want to say super clearly is that if you get a test and it comes back negative, you cannot know that you are uninfected except at that one moment in time. In fact, even at that moment in time, you may be infected but not infectious because you won't have much virus yet, but you may actually become infectious the following day. So a negative test cannot rule out infection, but a positive test actually confers infection. And so I want to say that clearly because a number of people have wanted to go connect with someone they haven't connected with in a while. They may have done some things that might have been higher risk than they should have done, and they think that they can just take a test and rule out infection, and unfortunately that's not the case. If you wait 14 days, there's a good chance that if you got infected 14 days ago, you would have seen the symptoms by now, so that's probably fine, but you have to be totally safe for 14 days before you can kind of rule out that risky event you took 14 days ago. And so that's a long time, and that's why I think personally, I would just prefer to not do those high risk activities in the first place because I don't have to be worrying all the time whether I'm infected, that's gonna come back to get me. So, that's a testing clarification that I think people are really still misunderstand, that a negative test does not mean you're totally good and don't have the virus at low levels in your lungs that you're gonna show up, say, 3 or 4 days later.
Gotcha. Thank you again for the thoroughness of that response. I think the big takeaway is, safe than sorry. Even if you had testing at some point, it doesn't mean you're not still a risk to yourself or others. So last question, since we're really here at the end, and I want to appreciate both your time so much for being here with us. We've had a remarkable number of attendees still hang around even to this point. So It's about masks. What are the best types of masks to wear? How effective are they? How do you know that they're being worn properly? That seems to be the most common question that we're getting in the chat that we have time to answer.
Yeah, so we have learned a lot more about masks and face coverings during the last 6 months. Asian countries have been wearing masks for a long time for disease prevention, and we in the Western world have kind of brushed that off and thought that was a silly thing, but it turns out that indeed, by wearing face coverings of any kind, we're protecting the people around us from that spray of droplets that happens when we talk or sneeze or cough or laugh or sing. But then it turns out now there's even increasing evidence that the wearer of face coverings and masks is also getting some protection. And there's some evidence and growing evidence that perhaps the reason we're seeing fewer hospitalizations and fewer deaths is that when people get exposed to the virus, they're actually getting less into their bodies because of their face coverings. And so the inoculum, the amount of RNA into our bodies is less, and it may result in a lighter, milder illness that's less likely to land you in the hospital or to die. And so as Marm said earlier, at the beginning, we really didn't want people using medical grade masks because of the shortage, and we wanted to ensure that our frontline providers had them. They are more protective for the wearer than cloth face coverings are in general. So we want, it's okay to wear those if they're readily accessible and as long as our medical providers have enough. The most important thing is when you're wearing your mask or face covering is to wear it properly. So I see a lot of people with their nose exposed, and that's it's better than nothing, but it's not enough. So we want to make sure that both the nose and the mouth are completely covered. So when you cough or sneeze or expel air, that you're not spraying droplets throughout the people around you and into the air. When I'm around in the community seeing people, that's the biggest thing I see is masks, down on the chin and not on the nose.
So I'll add one more thing to that, which is just that there's also been a ton of study now because the masks we know are useful on how useful different kinds are, which is, I think, was part of the question, Robert. And so Dr. Newel talked about part of that. But let me say that among homemade masks, more than a single layer is better. So if they can at least have a couple layers of cloth, that's important. And the mesh itself helps a little bit as well. So basically a bandana around your face is certainly better than no bandana around your face. But it's definitely not nearly as good as a mask that's say a couple layers or even 2 or 3 layers in a finer mesh cloth. And then if it can actually try to trap as many of the little droplets in kind of just humid air that's coming out of your mouth, the more it does that, the better. And so again, like a looser fitting thing that has lots of stuff flying out the sides is going to be good because you're still stopping at least this kind of spittle and droplets coming straight out, but you're still obviously letting lots of air go out with the smaller particles in it. So so the tighter fitting the mask, essentially, without obviously strangling you, but just kind of snug against your face, and as Dr. Newel said, covering both your mouth and your nose, and one that's not really a thin piece of material that basically isn't really stopping anything from coming out. Those are going to be much more effective in both ways, in both stopping this, protecting the people around the wearer and protecting the wearer themselves. So I think initially on, we were trying to get masks on everyone, and I think that's great. But I think for those people that are willing to wear a mask now, I think if you can, let's step up and take one more step and wear a slightly better mask. So let's move from kind of a single layer bandana or something like that to just at least a couple double layer or a finer mesh kind of cotton or even a surgical mask like Dr. Newel talked about.
And then I saw a question about runners and what kind of mask they should wear. And I want to remind people that as long as you're more than 6 feet away from others and doing outdoor activities or being outdoors, you don't need to wear a mask by my health officer order. And I think there's good science to support that. I'm hearing from community members, though, that if they're out and even if they're staying 6 feet away, that they're getting harassed if they're not wearing face coverings. That's unfortunate because the risk for outdoors being 6 feet away is so small. We do ask that people who are outdoors running or at all do have a face covering or mask with them. So if they're going to be within 6 feet of someone, you know, they run into someone they know unexpectedly and want to have a conversation, that they're able to put a face covering on.
The other thing I'll say, just to maybe allay a little bit of fear and concerns that way, is that there are really, actually, I don't think of actually any cases that I've heard of traced back to, I was out walking on the street and a runner ran by me, and that was the most likely way I got infected. So I think obviously it's great to have as much space as you can, especially when you're exercising and pumping out lots of air as you're running. But if you're a walker or another runner and you pass by someone briefly and there's a 1/10 of a second where you're within 6 feet of them, the chance for infection happening during that event is so small. I wouldn't even worry about it at all. I obviously try to avoid those things, but just take reasonable precautions. And you don't need to either chastise a person that runs by you within 6 feet, nor be freaked out yourself if that happens to you. Just try to give space to people around you and be a little bit considerate. So those types of events are really, really extremely low risk. And obviously, and the much riskier thing, as Dr. Newel said, is finding the friend that you saw and stopping and having, say, a 10-minute conversation with them from 2 or 3 feet away without a mask on. That's thousands of fold more risky than the kind of very quick passing thing that might occur with a runner going by you. So I think that's where we should try to focus our energy.
Awesome. And thank you both so much. On the topic of masks, our free mask giveaway, or the potential to get a free mask, we have 100 to give away. Please go to this link. It's bit.ly/merge4. So that's bit.ly/MERGE4. That's your opportunity to potentially win one of the 100 free masks we have to give away. They're quite stylish, and you will also be safe wearing them, much safer than not wearing one. So thank you everyone for attending tonight. Thank you so much, Marm and Gail, for all of your work on this issue, for all the information. You have definitely helped a lot of people. Just a friendly reminder, folks, we are still in shelter in place. This means limiting non-essential travel outside of your household. If we can stay more than 6 feet apart from each other, we can stay outdoors, we can wear masks, and we can properly sanitize, we can cut down on the spread of this virus, and we can all do it together and keep Santa Cruz off that watch list. So again, thank you everyone for being here. Thanks to Santa Cruz Works, thanks to Small Business Development Center at Cabrillo College, and thanks to the Community Foundation of Santa Cruz County and for the Santa Cruz County Business Council. I hope you all have a wonderful night, and I hope you learned something today.